And just like that, South Africa has passed 100 days of lockdown. For some of us, it's meant 100 days of Netflix, while for others, it's meant 100 days of loneliness and anxiety. For most of us, it's meant 100 days of banana loaves. And all of us have had times that we have been seriously, seriously concerned. It also meant that we have appreciated some of the things that we took for granted before lockdown started, or before our world, in fact, was turned upside down. Numbers in South Africa, and indeed around the world, are still rising at a frightening rate, which means more uncertainty and more worrying. Your questions reflect exactly that. We've received about 20 pages of questions from you. Thank you for reaching out to us. We are going to do our damnedest to answer as many of them as we can. What we've in fact done is group them into different areas, and we're going to try and cover them in the most efficient way possible. It is Sunday. It's July the 5th. I'm Howard Feldman. This is your Synthesis Sunday podcast with COVID expert, Dr. Anton Meyberg. Good morning. How are we doing?
Good morning, Howard, and good morning, everybody. So we're currently sitting on 11.3 million cases worldwide, with 533,631 deaths and about 6.4 million cases resolved. The United States has hit 2.9 million cases with 132,000 deaths. Brazil has hit 1.5 million cases with 64,000 deaths. And South Africa has 187,977 cases with 3,026 deaths. Currently, there are 5,598 patients in hospital throughout the country, with 2,232 patients in Gauteng in hospital, 311 of them in ICU, and 129 of them are currently ventilated. There are 31% of the national number comprising of Gauteng, of about 59,373 cases of the total number in Gauteng. The numbers in Gauteng are screaming up. The numbers in Western Cape are rising, and the numbers in Eastern Cape are screaming up. At the moment, we are in a big quandary. Our peak is coming closer and closer. The surge is here. We are seeing numbers of more than 10,000 a day as of last night, and we expect it to go up to about 12,000. This is probably at this point in time worse than what we saw in Italy.
There's a lot of anxiety around hospital beds. We're hearing, we saw on the city press, they were talking about running out of beds, running out of oxygen, people fighting in the Eastern Cape over oxygen. What is the real story? What are the facts on the ground?
It's a very difficult case at the moment. Hospitals are full at the moment. There aren't enough beds at the moment. ICUs are filling up. There are other places like Nasrec and a few other field hospitals that are supposedly going to be starting filling up. But the problem is these hospitals don't have oxygen. So that's a big problem, and that defeats the whole purpose. There are stories of oxygen running out at certain hospitals, and a lot of hospitals are taking strain and burden with the oxygen requirements. When people come into hospital, they require oxygen. Some people require higher percentages and higher volumes of oxygen called high-flow oxygen. So we are under great demand from companies like Afrox and all other companies to try and supply us with the right amounts of oxygen that we need. We are in trouble at the moment. We are losing numbers of beds daily because we're admitting multiple patients. Most of the patients are very ill. Most of the patients are requiring oxygen, and a small amount of the patients are requiring ICU. The only problem being that our healthcare workers are now getting sick, including doctors and nurses. So we are strapped across the board. We are trying our best to try and defeat all of these problems, but at this point in time, we are struggling.
All right. So if somebody does need hospitalization, does this mean that there's a real chance that they might not get a bed?
So at this point, I would say no. They probably will get a bed. You've got to understand that it goes on a rolling system. So each hospital, if they are full, there's plenty of other hospitals in Gauteng that can try and take those patients. And on a day-to-day basis, hospitals give their updates to the hospital managers and throughout the whole Gauteng area to say how many hospital beds are available. So if your local hospital is full, you will then be diverted to another hospital where there are more beds available. Each day when patient is discharged, more beds are made available. So we still do currently have beds, but the beds the number of beds is getting smaller and smaller as we go along.
So we are not in a situation that they were in Italy, where they were turning older people away, for example.
We're not turning anybody away currently, but we can't say that will not be the case in the next few weeks.
Do we have enough stock of the appropriate medication?
We do have stock of the appropriate medication, and they're ordering large amounts from different places in the world to come and try and make enough of it available for all of us. At this point, we have got enough. We are trying to stockpile as much as possible. We do have enough of the medications like the corticosteroids. We do have enough of the vitamins. We still don't have drugs like remdesivir available to us because that's a Section 21 case and is trying to be applied through the Council of Medical Control Council. Hopefully that will be available to us in the next few weeks. And we currently still do not have convalescent plasma available to us. That still has to go through a randomized controlled trial, and that will only be available in the next 2 to 3 weeks, hopefully 3 weeks. And even then, it will only be given out on a compassionate or clinical trial basis.
Surely there's a way to fast track some of these medications. Never mind, I'm not even speaking about the plasma. I'm speaking about medication that's being used all around the world. We've had 100 days. Surely this should be a priority to get approval in order to start treating patients.
I totally agree with you, but you're relying on suppliers from overseas that are stockpiling the medication in their own countries and will rather keep it there than give it to us.
Okay, so is the issue supply, or is the issue the authority or the permission to use the medication?
I think it's a combination of both. Each one needs to be sort of sorted out before we can go ahead and use them.
Okay, let's just talk about it once we were speaking about this. So where are we with the antibody testing? Because somebody that I spoke to mentioned the fact that there seems to be this conflict between private laboratories, government laboratories, what the protocols are to test antibodies. Where are we with all of that?
So I think we still need to work out what level of antibody we need for protection and how long the immunity will last. The antibody test doesn't show an active infection. I think that's very important to stress. It's not active infection. It shows immunity to the virus. Remember, the antibody is a protein that is produced by the immune system to attack the virus. It attaches to a protein signal on the virus and neutralizes and destroys that virus and removes it from the body. We need an antibody test with extremely high specificity, more than 99%, probably 99.5%, so that we can make sure that there are not too many false positive tests. We also don't know, as we've stated before, how many of these tests are actually picking up other coronaviruses and not the COVID-19 virus. And that time will tell. We'll see as we go along. The ones we're working on at the moment are the Roche tests, the Abbott tests. Those aren't commercially available just yet, but should be available very soon. But I think you've got to understand an antibody test is not the be-all and end-all of this whole virus. Just because you've got antibodies doesn't mean you're going to be okay. In the first week, you develop IgM, which is the acute phase antibody. And after about 10 to 14 days, you start developing IgG antibody. We don't know how long that lasts. We have got some evidence from the SARS virus. It can last a few months to hopefully a few years, but we just don't have enough evidence at this point in time if you'll have immunity for many months or many years. And that we'll have to wait and see what the studies show as we go along.
So the short answer to if somebody can be infected twice is we actually don't know.
We don't think somebody can be infected twice. And that's a very important question because there are a lot of people are saying, well, I got the infection now, and then 3 weeks later, I got another infection. And we believe that people who supposedly got the infection at the beginning were probably a false negative because most of these people don't have any symptoms and they're completely asymptomatic when they get this positive result. But then 3 weeks later, 3 weeks later, they develop severe symptoms, they develop the cough, the shortness of breath, and that's most likely the real infection that is developed in them. So we don't know about does infection protect against reinfection. We don't know that yet, but we haven't got any evidence that you can get reinfected with the same virus at this point.
Okay, so we don't know that because there's a lot of questions about that. The other question that a lot of people are asking is we're seeing this tremendous surge of infections, certainly in the United States, around the world. Israel's dealing with the same thing. Is this a second wave? And is it possible that South Africa is just combining everything all at the same time?
So we're not combining. Remember, we're lagging behind the rest of the world. Our virus we only went into lockdown around the 26th of March. And our first cases only came in the beginning of March, where the rest of the world started their cases January, early February. So we're at least 6 to 8 weeks behind the rest of the world. Our cases are surging, our cases are peaking, they are dramatic at this moment. But the rest of the world thought they had beaten the virus, and they started having protests, and they started allowing people to go out in large numbers. And they are following the ramifications of not actually treating the virus effectively and not eradicating the virus due to the fact that there's no immunity yet and there's no herd immunity yet. So whether we want to call it a second wave, it's debatable, but we don't have a second wave yet. We're still in our first wave of the virus, and we will be for a long time until we manage to plateau and start rescinding the amount of virus shedding in the country.
How are we doing in South Africa in terms of the death rate?
So our death rate is low. We're sitting at 3,000 cases, which is not dramatically high, but we're still rising in the amounts of cases. If you look at 10,000 cases yesterday, and as I said, we're expecting to go up to 12,000, possibly even higher, the death rate is going to go up. As hospitals do start filling up, and as there's lack of availability of beds, we'll see a higher death rate, unfortunately. The elderly people, the ones who have got severe comorbidities, who've got no immune reserve, those people are the ones who are going to suffer dramatically. So our death rate is low at the moment, but unfortunately it's going to rise dramatically.
Are we accounting for all of those deaths? And just to explain the question, I take a look, and I generally look at the number of Jewish burials within Johannesburg each day. And on average, you'll have around 700 burials per year. You can obviously, this time of year in any event, it's just a little bit higher. But for the last week or last 2 weeks, we've probably had in fact, not probably, we've had more burials per day than we have ever seen. A lot of those cases are not known to be COVID cases. Can we assume that a lot of them are, especially with older people?
You see, what people are forgetting is there's a world outside of COVID-19. There are other diseases: myocardial infarction, cancer, diabetes, hypertension, strokes, coronary artery disease. There are multiple other conditions that cause illness and can lead to people's deaths. We are seeing a large amount of people that are dying from COVID-19, but the majority are not dying from COVID-19. The majority are dying from the other comorbidities. Some, by chance, do have a finding of actually having COVID-19, but they haven't actually died from the actual disease. But once they've tested positive, then a lot of the staff are putting on their certificates, it's a COVID-19 related death. So we've got to be very careful about that, and which are the actual cases that are related to COVID-19 and which are the actual cases that are related to comorbidities and other chronic terminal conditions.
Are we still seeing people being neglectful? At one stage we were, that they were neglecting other conditions because, for example, they were afraid or concerned to go near a hospital, to go to a doctor. Are we still seeing that?
We're definitely seeing it. There's no doubt about it. People are petrified to come to the hospital. And when people are coming to hospital, they are really on their last leg, literally. People are coming in extremely ill, extremely sick. We want to try to get people in when they're not extremely ill. We want people to come in earlier so we can treat them earlier. There's a huge benefit to putting somebody on oxygen early and treating them early than rather they come in when they're beyond repair.
All right, quite a few questions around this, Sybil being one of them, saying, I need to have a small tumor removed from my eye. I'm 65, I have comorbidities. My doctor says it can wait 6 weeks. Obviously, I want it done as quickly as possible. Should I rather wait and not go near a hospital?
So in my personal opinion, I believe we shouldn't be doing any elective surgery at this current time. We've got to stay away from it, especially if your doctor says you can wait 6 weeks. Even if it's a small procedure, rather stay away. Because if you've got multiple comorbidities, we can't prevent, or we can't say that you won't need to go to ICU post-operatively, or you won't need to go to high care. And there's a lack of beds. These beds are being reserved for patients who are on ventilators or are extremely ill. And if you do land up in trouble, then there's going to be big problems. All the hospitals are getting full of COVID patients. People are dramatically rising in their surge of respiratory illness, pneumonic illness, the hyperinflammatory syndromes. So if you can stay away from hospital when you've got a minor procedure that needs to be done, rather stay away and get it done at a later date.
A few questions around the accuracy of the numbers in South Africa. And I'm not talking about what I was referring to before, but rather the number of cases, people being tested, the results that are being reported. How far behind are we? So what we're seeing last night, does that reflect yesterday, or does that reflect 4 days before or a week earlier?
So that reflects the last 24 hours. You got to understand that, as we've said before, the Western Cape has stopped doing multiple tests, and now Gauteng is stopping to do multiple tests on people. 2 of the major labs have put out statements that they'll say they will only test people who are acutely ill and have been sent with a referral note from their doctors, or they will only test healthcare workers or people who are in hospital. We do not have enough tests. We do not have enough reagents. So we aren't testing as many people as we should be testing due to the fact that we don't have the numbers.
Okay, so in other words, what we're seeing is accurate, but we're not testing enough people still.
100%.
That's probably...
We know there's a lag still in the amount of cases coming through, but we're hoping that it will sort of stop in the next few weeks, because if they're testing the required amounts and the necessary people, then we won't have such a lag.
This question keeps coming up, and somebody sent it to me as well, saying that CNN reported that it could be that smokers are protected from COVID. Can you please speak to that? Because, as I say, it's a recurring question.
Yeah, we don't really believe CNN, especially with their health-related inquiries. Okay, I mean, it's like reading the national tabloid and asking them for a sort of what they think about the medical treatment of certain conditions. The point of the matter is that smokers are at higher risk of COVID-19, at a higher risk of getting more severely infected. People with COPD, chronic obstructive pulmonary disease, smokers have an enhancement of these ACE2 receptors. These are the receptors that the virus attaches to. They have a higher chance of getting COVID-19 and a higher chance of getting sicker. So no, nicotine does not help with COVID-19. Smoking does not help with COVID-19. Stop smoking. Save yourself years of torment, years of damage. Save yourself the need for oxygen. Save yourself getting emphysema. Smoking does not help.
An interesting question from Gary. He says, and it's so funny, I've noticed the same thing, but didn't think to verbalize it into a question, is wherever we go into a shopping mall, certainly when you go into an office building, somebody has to come fairly close to you with that horrid thermometer. First of all, I've never seen an accurate reading unless my temperature really does hover between 33 and 34 degrees, which would be surprising. I mean, I have been told I'm cold-hearted, but not that cold. But secondly, sometimes, I feel a bit uncomfortable about just how close the person with the thermometer is getting. He at least could buy me a drink beforehand. How safe are those thermometers?
So I think that people need to understand, first of all, it's infrared and it's not going to cause radiation or cancer. That's the first thing. The second thing...
I didn't even know to worry about that. Thanks a lot.
I forgot that the hypochondriasis is something that you've got to deal with.
Yeah.
It's a big problem with you.
What do you say, radiation poisoning I might have?
Okay. You probably have got radiation poisoning. I'm seeing there's not much hair on your head at the moment, so we've got to worry about that, but we'll address that at a later stage. On a serious note, the thermometers are a very good screening tool, but they're not the most effective screening tool. You've got to understand we don't have much in our armamentarium to basically control this whole situation. So if we had a rapid test that was available and you could test people within 15 minutes, that would be our first prize. They've got that in overseas, but we don't have that available as of yet. But at this point, we've got to use what we have available. So what we have available is these thermometers to test people. They don't increase your risk of getting COVID-19. They don't give you a precise reading, but they do tell you if your temperature is up, and that is enough of a warning sign or a signal or a flag for us to know that something's wrong. We also got to take it in entirety with a group of questions. And when you come into a hospital or when you go into school, it's not only the temperature that we take as our guidance. We ask a whole lot of questions. Have you been exposed? Is anyone in your house who's been exposed? Do you have any other symptoms? So that together as a collective question is a major tool in us trying to decide if you need to be in that area or not. So yes, the thermometer is not the best tool for us, but it's one of our only tools we've got available at this time currently.
Okay, so we have to use it because really we don't have a lot of options.
Right.
Okay, this was sent to me by a doctor, an anonymous, who asked to be anonymous, saying certain doctors are exercising without masks and insistent that one doesn't wear a mask for exercising, because especially if one is isolated on the road. But then they forget to put on the masks when they approach others. Surely they should be our role models of virtue and compliance. Also, shopkeepers not wearing masks or wearing masks but that go under the nose. Surely all of this is a major problem. Can we just speak about, as well, when you address the question, the wearing a mask just over your mouth issue?
So, yeah, I don't know if it more was a question or a statement but it's a good point.
Maybe even a plea. Maybe it's a plea.
Yeah. When you run, when you cycle, you need to wear a mask or a buff. It's got to cover above your nose and below your chin, not below your nose and not above your lips. Okay. It's very necessary for two reasons, or actually for multiple reasons. A, because you can't be selfish, because you can transmit the virus to other people. And that's very important. And it's your selfishness that will transmit it to other people. I don't care whether you're a doctor, whether you're a spiritual leader, whether you're a politician, every single person needs to wear a mask on the road. If you think that you're not going to come in contact with other people, you will come in contact with somebody. And you've got to worry about getting into a slipstream. So if people come behind you and you cough, there's a high pressure of particle that's expelled from your respiratory tract that can affect them. You wearing a mask protects them. You wearing a mask protects yourself at the same time. It's a double barrier. You have to wear a mask when you're out on the road. Don't be selfish to other people. There are still plenty of people, unfortunately, as I saw this morning again, who are riding, who are not wearing masks. There are plenty of people who are running, who are not wearing masks. Don't be selfish. This is not a time for us to be selfish. This is time for us to protect each other.
And the issue of wearing a mask over your mouth and not your nose?
Well, it defeats the whole purpose because it's a respiratory virus. So you're still going to expel the virus from your nose. So there's no purpose in that.
Somebody sent me a message as well, also asking to be anonymous, saying they're very, very worried about the grandmother. She lives completely alone. They would love to be able to visit her in the garden, sit far away from each other. The problem is that she will only wear a mask over her mouth. But let's assume that she would wear a mask over her mouth in order to counter some of that loneliness. What is your thought about visiting in a garden and staying quite far apart?
So I think it's very simple. I love my parents. I'm not allowing my parents to see me or my children. That's because I love them. That's because I want to protect them. That's because we are going through a major surge now. That's because there were over 10,000 cases yesterday. This is a highly transmissible virus. If you've got comorbidities, you're at a higher risk. Protect them. We have to protect them. We have to be selfish in ourselves in not allowing them to see us and their grandchildren by protecting them and showing love. That's how you show love. That's how you protect them.
And can we just talk about kids again? Because there's a lot of questions around school, and I was waiting to go there. Can we just firstly understand the transmissibility of the disease through children?
So as we said before, kids are not super spreaders, but they still can transmit the virus. Children can still get, for the most part, multi-system inflammatory syndrome, as well as what we call a Kawasaki-like illness. They can do that. A small amount of children do it. Although the children don't get dramatically ill, they still can get sick with the virus, and they still can transmit it to other people. But we know, like influenza, they are not the super spreaders. So it doesn't mean then that you can be around your grandchildren because they're not super spreaders. They still can transmit it to you. And we've got to be very careful and very aware of this. And I think it's very important in that whole sort of vein to discuss that a lot of the schools are going on school holidays in the next week or two. I implore you, on school holidays, please do not have play dates. Please do not have social interaction. Keep your kids at home. Let them do Zoom meeting with your friends. We know it's not easy. We know it's very hard, but you need to protect yourselves. You need to protect your community. If we want our kids to go back to school after the holidays, we have to be vigilant. We have to make sure they all stay at home and do not engage with other children so as not to transmit the virus. And once again, parents are the ones who generally transmit the viruses to the children when they come back from work. More so, don't interact with other families. Stay at home and stay safe.
I think maybe things that people could do, and we do need to think about that. We should probably put together some ideas. Maybe I can discuss it on one of my shows, is things to do with your kids during the holidays with their friends. There's online games. You could play bingo, you could play, depending on the age of the kids, there's quizzes, there's all sorts of things that you can do. And it also gives a bit of a structure to the day, that at 10 o'clock or 11 o'clock in the morning, you get together with some of the friends and you play a game. It's, we do that with poker. It's just worth doing just to maintain the little bit of sociability.
So speaking about that, and I think, speaking about the kids at home and all these type of things, I think a very important point is also to dilute this myth of corona parties. There's a lot of people out there.
I was going to ask you about that. Do we have a corona party in South Africa?
It's a very good idea, said no one ever. Do not have corona parties.
Okay, well. What is a corona party? Don't shout at us if we don't even know what it is. What is a corona
party? Is a party where you have an infected individual that comes to the house. You have multiple people there not wearing masks, staying together, eating together, socially interacting with each other, and spreading the virus to each other so that they can get immunity.
Deliberately?
There are multiple problems with this. First of all, we don't know if infection protects you against reinfection. We don't know how long the antibody immunity lasts. As we've said, children can get the multi-system inflammatory syndrome. They can get a Kawasaki-like illness. And with this deliberate exposure, we don't know how many people will have extensive and severe complications. We also don't know that when an asymptomatic person transmits the virus, that the person they transmitted to will not land up in ICU and can potentially die from this. The biggest problem that we've got is we don't have a toolbox of medication to treat this virus, as well as we don't have the healthcare capacity for these corona parties. Please, I implore you, stay away from this. It is a very, very bad idea.
And it's actually happening here because no one's invited me, and I do suffer from a bit of FOMO.
Hashtag you're not invited.
Well, all right, fine. Okay, just to be while we're still talking about schools, you still maintain schools opening is the right thing. Schools are managing. You're involved, I know, with a lot of advising a lot of the different schools. What are you seeing happening at the schools?
So once again, we're not seeing the children transmitting the viruses to each other. We are seeing cases of parents being positive and then those children being exposed. And because the children are in their bubbles in a single classroom, you're able to extract the child. They're having social distancing. They're wearing their masks. They're washing their hands. You can extract the child safely from that class. The class is then fogged or cleaned or left for 24 hours and cleaned thoroughly. And there's no inherent risk of transmitting it to the other children. We're about to go on school holidays, so we've got about another week or so of school left. And the whole point of that is it relies on our community and our people to decide if we're going back to school after the holidays. If people manage and maintain and actually stay away from other people, we will be able to go back, even despite a surge or despite a major peak of people getting the virus. Hopefully, we'll be able to go back to school if everything is maintained and in order.
One of the concerns that a number of our listeners have is the support staff at school, that because taxis are running at full capacity, it's obviously a concern for obviously the workers as well as the kids potentially.
So you got to understand that unless your child's in pre-grade, and even then I don't think your child should be going to school in pre-grade or that, because they need more attention, they need more love, they need to be touched and held, then other workers aren't directly involved with your children. The teachers are involved, they're in the classroom, they're maintaining their social distancing, the desks and everything is cleaned every hour. So I don't believe you've got to worry about that.
Another interesting question is that as an anonymous person says, I took my kids for a walk around Glen Hazel and we passed Galliot Park. The amount of teenagers hanging out there, no mask, definitely no social distancing, was actually a shock to see. CSO was driving past. I asked them if there's anything that they can do, and they said that they are not allowed to. No wonder COVID is spreading so rapidly. CSO being the Jewish organization that worries about security in the community. There's all sorts of other organizations. I mean, my view is that I don't believe it's their job to police the wearing of masks. Your thoughts?
I don't believe it's their job, but I wish it was. I've spoken to many spiritual leaders and I've asked them to put out a judgment saying that it's spiritually the correct, religiously the correct thing to do to make people wear their masks to protect other people. It comes from a parental point of view, allowing your children to go out, go in a park and cohort together without masks. That's got to come from home. That's got to be an education thing. They've got to see their own parents doing it for them to realize how important it is.
We are running out of time, but I do need to ask you all about isolation because there's a lot of confusion around it. Marco says, my mom is an estate agent and was in close contact with a client who since confirmed that he was in prior contact with a third party who tested positive for COVID-19. Although she's not exhibiting symptoms, at what point should she get tested, if at all? So now, and this is a lot of where the confusion comes into it, is if you're in contact with a person you've explained who's positive, you've explained to us 14 days, you don't need to be tested unless you're symptomatic and then speak to your doctor. If you're in contact with a person who's been in contact with a person who's positive for COVID-19, do we need to stay in isolation until the middle person gets their results, if they or get sick or doesn't?
So we've got to define what contact is and what is the primary contact of that person who's in contact with the other person. Were they both wearing masks? Were they in contact for more than 50 minutes? If they both weren't wearing masks and they were in contact for more than 50 minutes, those are primary contacts and you are then a primary contact with them. If they were wearing masks and if they weren't together for too long and they were outside in an open area, there's less chance of transmissibility. So you as a third or fourth party don't have to isolate yourself. You just got to watch for symptoms. If you do develop symptoms, then isolate yourself. If the symptoms get worse, then go for a test or ask your healthcare worker to test you. But you have to be very, very pedantic. If you do get symptomatic, speak to your healthcare worker and discuss it with them, and they will give you the relevant advice whether or not you need to isolate or quarantine yourself.
All right. So you've actually, there's in some cases, there actually isn't a hard and fast rule. You've got to look at all of the factors around it.
Right.
All right. That's more or less where we leave it. Is there any good news?
So I think I'd like to quote from one of my favorite superheroes. With great power comes great responsibility. We have seen our community and our people basically rise up to the challenge. We have seen kindness. We have seen care. We have seen doctors, nurses, educators, family people, everyone just stepping up and being available to help everybody else. We are seeing it on so many levels and we can be proud on so many levels. People are looking after each other. People are looking after each other's lives. They have the power to look after each other and they are taking that responsibility and making it happen. Just be safe. Just be well. We are in for a long run here. Things are going to get tougher, but the power and the responsibility are in your hands. They're in our hands. They're in my hands. They're in your hands. We all need to do this together. We all need to set the example. We all need to be beacons of light and show each other that we can look after each other and not be selfish. Be safe and have a good week.
Dr. Anton Meyberg, thank you as always. And I couldn't agree more. Certainly with the thing that I've seen in the 100 days that we've been in lockdown is just how absolutely incredible people are. I believe that, as Anton said, people have risen to the occasion. The level of kindness, charity, love, care that we have shown for each other is absolutely remarkable. That's what we need to focus on. We need to keep worrying, keep caring, and I believe that we will get through this together. I'm Howard Feldman. This is the Sunday Synthesis Podcast. Have a safe week and wash your hands.